This year, nearly 5 times as many cases of pertussis, more commonly known as whooping cough, have been reported. Although we think of it as something that only affects babies and children, whooping cough can be extremely dangerous for older adults. Whooping cough often starts off like a common cold, but the symptoms soon intensify. They can include violent coughing that leads to a whooping sound, sneezing, nasal discharge, fever, sore, watery eyes, lips, tongue, and nail beds that can turn blue during coughing. Whooping cough can last up to 10 weeks and can lead to pneumonia and other serious complications. If you've never been vaccinated, schedule an appointment with a healthcare provider to receive one. If you are vaccinated as a child, you can receive a booster every 10 years. If you are 65 or older, a Boostrix vaccine is recommended. We can provide testing, treatment, vaccinations, and support. Together, we can eliminate whooping cough in our communities.